temperature-wise, is it okay in this room, you guys, or is it too hot, too cold?
Great.
Is it okay?
Great for you
right.
guys? Okay.
And I don't know if you all know where the restrooms are at, but that's an important thing to know. They're out and around the corners back here, okay?
Okay. I'm Beth Morrow, and like she said, I'm the respiratory therapist here at the hospital. I've been here 5 years. And originally, I worked in Waterloo in the trauma center, and then I worked at the University of Iowa, and I was an intensive care specialist. And then I worked at the Washington County Hospital and was the Cardiopulmonary manager. And then I went to Henry County for 3 years and ran the sleep lab and did testing for sleep apnea and sleep disorders. And then I got tired of working at night, and this job opened up, so now I'm here. And I live in Wayland, and I have a husband and 4 children who, when I'm not here, keep me very busy there. So, and I'm not really on vacation. I'm moving my daughter to college. That is work, work, work. So what we decided to do is kind of combine these support groups, and we also have a pulmonary rehab support group, but none of my patients are here. I must have taught them so well they didn't need to come again. And we're going to talk about the respiratory system, some about how it affects heart and diabetes. We're going to talk about trying to prevent getting some respiratory pulmonary infections, what you can do, to try to keep yourself healthy before we get into that season. We're just seeing a lot of it already, even in August. I'm just astounded at how many respiratory infections and pneumonias that I'm seeing in August, because I don't usually see this stuff till late fall, and I'm already seeing a lot of sick people. So, you know what? I need to get myself a pamphlet so I can tell you where we're going to go. So, we're just going to start at the top and work down and just kind of do some basic. This is anatomy. This is the respiratory system. And then we're going to talk about what can go wrong with it generally, and then we'll talk about some prevention measures and kind of just go from there. Okay? So the first thing we need to talk about is your nose, and it's a very important organ. Our nose has, besides to hold our glasses, has 3 functions. There's little hairs in there that filter out the big dust particles and other kind of big germ particles. Our nose heats the air that we breathe in, and it moisturizes the air we breathe in. So when you get a cold, when you get that head cold, or you guys that have allergies and your nose gets all stuffed up, and then you're breathing through your mouth, that's why your mouth gets so dry, and you get that dry, awful cough. It's because you're bypassing that nose, which is doing those 3 functions. In the winter, when you get those bad colds and you want to run a humidifier, either those small room humidifiers, so that especially when you're sleeping and you're breathing hard through your mouth and you get all dried out. What I want you to know about those is you need to clean them on a regular basis. Don't bring them out in October when you turn on the furnace, or September, and plug them in and just keep dumping water in them until spring when you don't need it anymore. And look at him laughing, because that's probably what he does. The problem with them is there's filters in there, and you never use all of the water. And so that water becomes a reservoir, and those are nice and dark, and they get heated from that fan motor, and they grow horrible bacteria. And then that bacteria gets on those little water particles that you're blowing through the air, and then you breathe it, and then you get sick. So the key to using the humidifiers is to clean them. Every couple days, take them apart and just wash them in sudsy water in your sink. They have come out with a recommendation that you can put a little, like 1/8 of a teaspoon or 1/4 of a teaspoon of bleach in there, and that's just like chlorine in a swimming pool, and that will keep anything from growing in there when it's going all through your house. So that's the gist on those room humidifiers. Okay, does that make sense? Because those, all right. Especially when you got the cold and it's bypassing your nose and you're bypassing your first filter system. Okay, and so then we get down to your voice box, your larynx, and then if that gets infected from a virus or a bacteria, that's when you get a bad cough also, but you get the laryngitis. Okay, and you get all dry and hoarse, and that's scratching hurts too. Then we go on down your respiratory system, and now we finally get to where we have it on the page. Your windpipe, and then your windpipe splits, and you have a breathing tube into each lung. And if you get an infection there, whether it be a virus or a bacterial infection, that's a bronchitis, because it's in your bronchioles. In your trachea, your windpipe is kind of counted in that. And it makes it hard to breathe. And you cough and you hack, and it takes about 10 days usually to run its course, and that's called a bronchitis. Then as we go down the respiratory system, you see all these other little airways way down in here, these little teeny weeny ones, which actually start looking like this. Okay, if those get infected, whether it be a virus or a bacteria, that's called bronchiolitis. And it's just a distinction because it's a smaller part of the lung. And when we see a lot of babies that are admitted to the hospital with a pneumonia or with respiratory difficulty, that's usually where their problem is the bronchiolitis. And it's for children under a year old, it's a pretty serious condition, and it's caused by usually by a virus. So unfortunately, antibiotics don't help, and we have to let it run its course. We just have to give the babies oxygen and keep them hydrated and kind of let it run its course. Some steroids are helpful. And then finally, when we get down to the very end, these great clusters, they're called alveoli. That's actually where the oxygen goes from your blood, from your lungs into your blood, and your waste gas comes from your blood back into your lungs for you to breathe out. And that's where all that happens. And when that gets infected, or with any of these other infections, if the secretions drain and kind of plug you up because you can't hack them up, that's a pneumonia down in here. Okay? Now, I know a lot of you guys are cardiac people. That's also where your congestive heart failure is. Okay? What happens is, for some reason, your heart isn't pumping your blood around efficiently, whether you have too much fluid on board, or you're having an irregular heartbeat, or your heart has weakened for whatever reason. The heart isn't able to pump enough blood around, so the blood backs up. And then some of that fluid from that blood actually backs up into the lungs, into these little air sacs. And these little air sacs get full of fluid, and that's what congestive heart failure is. And if the little air sacs are full of fluid, then you can't get the oxygen from your lungs into your blood and vice versa, and you get very short of breath, and you start that cough, and you can't lay down to sleep, and then you need to see the doctor. And your water pills increased, or they have to make some type of adjustment. Some people end up in the hospital because we have to regulate them with IV medications and maybe give them some oxygen until they get over it. And we see a lot of people come in through the emergency room that way because it always seems to hit in the middle of the night. It's just one of those things. They go to lay down and go to bed, and they get really short of breath, and as the night wears on, it gets worse and worse. And so we see, in Chris, who works in the ER, we see a lot of those type of people come in the evening, in the middle of the night, and early morning. And a lot of that it's scary, especially if you live home by yourself. All of a sudden you can't breathe and you're starting to kind of rattle. So that's why we're here. We just come on in, and even if we take care of you and turn you around and send you back home, at least you know that everything's going to be okay. On these lung diseases down here, the bronchitis, this is just showing the mucus in the little airway in it. And that's why it's important to keep drinking fluids even if you don't feel like eating. You can go without eating for a while. Well, maybe not you diabetic people, however you regulate that. But you have to keep this mucus thin so that you can cough it out. If you get dehydrated because you're not drinking enough, or maybe you get the nausea and the vomiting and the diarrhea, with this, that mucus gets really, really thick, and then you get plugging. You know, you just can't, when it just plugs everything shut. Then what happens is you can't get air beyond it. And then this becomes a growing ground for bacteria, and then we see a lot of people that go from bronchitis into a pneumonia, and that's why that's happening. They start with the bronchitis, so they have the virus, or they have the bacteria in their lungs, and then it starts to get plugged shut, and then behind there it starts growing and creates a big pneumonia. So I don't know about any of you guys, but I'm sure you've all known people that's, you know, got the cold, and then they get the bronchitis, and then they get the pneumonia, and they, you know, they run the whole gamut. Emphysema, I don't know if anybody here has emphysema, but you all know somebody who does. What happens with emphysema, and those people are at a disadvantage to start with, instead of having all these nice little grape clusters like the rest of us, emphysema people end up with these great big huge air sacs. They're called blebs. What happens is as the disease progresses from the smoking or from the pollution that the person is exposed to, these little air sacs start rupturing because they're very thin. And you can't see them with the naked eye. You have to have a microscope. But these little walls start rupturing, and you end up with these great big huge floppy air sacs. And that's why people with emphysema have a hard time breathing, because they don't have a lot of places for the oxygen to get into the blood from their lungs, and they get very short of breath. And then if this gets infected with a pneumonia, you can imagine how ill they become. And it's very hard to treat them, because this pneumonia is very hard to clear up, because it's such large spaces for the bacteria and the phlegm to gather for us. The other thing that happens is, you see this air sac, how it's kind of got a skinny middle? This gets all swelled up in there. So imagine breathing through a straw, because that all gets swelled up in there. And that's what happens to those poor people. The other thing that we see a lot in the spring and the fall, but also happens with infections, is asthma. Sometimes respiratory infections will trigger an asthmatic-like response to people. And what asthma is their anatomy is completely normal, but there's these little muscles on the outside of our air passages, and they have like little spasms, like little Charlie horses. And then when you have those little Charlie horses going like this, that's when people wheeze. You know, and sometimes then they use their inhaler and they're okay for a couple hours or whatever, then they get bad again. So it's kind of like, we're giving a muscle relaxant to their little airway Charlie horses. And so it's kind of a vicious circle, because then you have to, whatever's making these muscles have their spasms, we need to figure out what that is and treat that, whether it's allergies, whether they have an infection. Some people are more sensitive to respiratory infections than others. Believe it or not, some people, stress will set them off, and anxiety, they get all tight and upset. I've seen some people here lately that look like they're having asthma, and they are just sick as dogs, and they just have horrible sinus infections that are draining and getting down into their airways and their lungs, and it's making them act like they have bronchitis and asthma. And as soon as we get the sinus infection cleared up and on the right antibiotic, the wheezing goes away and they're fine. It's been kind of odd. It's been a really odd summer with respiratory stuff. So when we get to, so I kind of gave you a couple handouts so you can see that. And on this second page, you can see on these little air sacs, the little blood vessels that surround them. So the oxygen can get into the blood vessels, and then the waste gassed out. The reason I gave you to this is because I know a lot of you guys are cardiac people here tonight. Those are where you get blood clots. Some of you guys have probably taken Coumadin and blood thinners. You have atrial fibrillation. When you get a blood clot in your lung, because of your irregular heartbeat or whatever's going on, that's what happens. It gets in one of those little vessels. Well, you can breathe as hard as you want to breathe, but if you don't have any blood there to pick up the oxygen, it's not going to do you any good. so you get very short of breath. So that's why they have you on your blood thinner or your Coumadin, whatever, Lovenox, whatever your blood thinner of choice is. So that doesn't happen. And with atrial fibrillation, those people have a tendency to throw little itty bitty blood clots. And so that's the reason that the cardiologists do that, to prevent that from happening. And that's also why if you've had any cardiac surgeries or any other surgeries, they give you, after the surgery, they give you sometimes blood thinners for a couple days till you're up and moving really well. Because when you're lying around in the bed or the recliner in the room till you're kind of up to your normal activity, your blood gets kind of stagnant, especially in your legs, and you're more at risk for throwing a blood clot. And then hopefully the blood clot lands in your lungs. It's the safest place for it to land other than your heart or your brain. And so that's why they give you blood thinners. Okay. If you flip to the third page, you have a little bit more color to look at this time. I gave you a sheet on avoiding respiratory infections, which is my big push because I want to try to keep everybody healthy. Not that I mind taking care of you when you come in to see me, but I'd rather see you in the high V. So we'll just kind of start at the top because I'm sure you guys all know people that have very serious health conditions, and you might be some of them, where a little cold or a little flu can kind of push you over the edge and make you very sick. You know, I get a cold or the flu, I probably don't even miss a day of work, or maybe I miss one day, and I'm better. But people with heart disease, lung disease, diabetes, that pushes them a little further over the edge, and they're sick a lot longer or more seriously sick, and sometimes you guys end up in the hospital. So, you know, there's two things that cause respiratory infections: viruses, bacteria, and funguses. Viruses, you know, they just live out there, and we get them everywhere. We get them off the grocery cart handles, off doorknobs, you know, from the grandkids that come over and visit and they got a cold, you know, and they're snotting all over everything, how little kids do. You know, so they're spread very, very easily. The biggest way to prevent any of this stuff is good hand washing. And I'm sure everybody, you've heard that 100 times and you're going to hear it 100 more. You know, that's why Chris and I and other people who work in the health profession, you know, we wash our hands when we leave a patient's room. Because even if I just, you know, came in, you know, asked you how you were feeling, made sure your oxygen was okay, you know, maybe handed you your box of Kleenex or your glass of water because you couldn't reach it, I still could have picked something up on my hands. And then when I go next door to the next guy and I help him do something, like pull up his covers, or maybe he just needs, you know, a little pat on the arm, I'm taking the germs from that room to the next room. And that's why you see us in healthcare do a lot of hand washing between rooms, and we wear a lot of gloves. And that is also to protect ourselves, because I don't want to catch your pneumonia and then go out in the hallway and on my nose. You know, because I'm going to get, you know, the odds are I'm going to catch it and get sick. And if I don't catch it, I'm still going to go home to my family. You know, and maybe I'm healthy enough that my body can ward it off this time. But maybe, you know, when I go over to visit my mother who has cancer and I sneeze in her living room, I left it there for her to catch. Okay, so that's why you have to be careful about that kind of stuff. For viruses, there's nothing you can do for a virus but supportive care. There's no antibiotics, there's no magic medicine to help a virus. You need to keep hydrated, you try to eat as well as you can eat, still try to get some exercise and some good rest. If you become very ill from the virus and you end up in the hospital, that's what we do for you here. You end up with an IV so we can keep you hydrated. You know, you're getting a lot of rest. We might give you medicine if you have a lot of aches and pains, or, you know, Tylenol for a fever, but you usually don't get antibiotics. And they can usually tell by your blood test if it's a bacteria or a virus. A bacteria responds to antibiotics. You know, and you can go to the doctor and get your Zithromax or your amoxicillin or, you know, whatever the antibiotic of choice is. And you know, those bronchitises and sinusitis and even mild pneumonias that we treat as people as outpatients will respond to antibiotics. The other thing we do for the viruses and the pneumonia people is you've probably all seen people get breathing treatments, or they run around with the little inhalers, the little puffers, okay? And all those are to relieve these spasms, and you know that you can get from these viruses and bacteria because they're irritating to your airways. It's to relieve those spasms so those people can get a deeper breath. And then, you know, if you can get a deeper breath, that means you can have a deeper cough and try to keep that stuff cleared out of there. And then, of course, we try to treat the symptom of people feeling short of breath. Because, you know, even when I get a bad cold or a bronchitis, 2 years ago I had a horrible pneumonia and was off work for 3 weeks. You know, and so I really know what the other side of the bed's like because I was there. You know, and it was I was terribly short of breath. I could hardly take care of myself. It was a horrible feeling. Funguses are kind of a different animal. They're spread through the air, and one of the ways is like, people who burn wood, you know, the smoke, there could be funguses in that smoke. In barns, when they're cleaning out barns or forking hay, you know, all that stuff gets in the air. There's funguses in that stuff. A while back, when it was last fall, I had a gentleman who, in here for a couple days, who was cleaning out his silo, and all that junk that's left in the bottom of the silo that gets moldy, you know, and he was in there scooping it by hand, and it got in the air, and then he breathed that in, and it took about 2 days, and he was just sicker than a dog. And what happened is his lungs were so irritated, they just swelled up so badly, you know, that he couldn't get he couldn't breathe very well. So he had to, steroids is what we treat people with lung swelling. And you have to think of your lungs as just like the outside of your body. You know, if you injure the outside of your body, you know, it gets red and it gets swelled up, and then as it gets better and the swelling goes down, you get a scab, right? And then the scab kind of gets smaller and falls out and, you know, disappears, and sometimes you have a scar, and sometimes you don't have a scar. Well, the same thing happens to our lungs. If you get a really bad, when you get pneumonias or bronchitises, you know, it's red in there too, and it gets swelled. You know, then as it starts healing, you know, you form a scab. You know, and then the scab has to be reabsorbed by the body, and sometimes there's scar tissue left. And that's why we see some people who are doing pretty well at home, and then they get a really bad pneumonia, or they get a really bad bronchitis, and we treat them, and they're here for 10 days or 14 days of antibiotic therapy and steroid therapy, and we do physical therapy to try to strengthen their muscles back up, and they just never get back up to how they felt before they got sick when they came in, and I'm sure we've all known people like that. It's because there's been lung tissue destroyed or scarred, and if it's scarred, it just doesn't work. You know, it's kind of hard. It doesn't stretch when you breathe anymore. The oxygen can't get through the scar tissue in the blood, and the waste gas back out. So that's, you know, we see a lot of people, especially when they get declining health, and we see them and we see them and we see them, and they just kind of keep going down that staircase and never get back up to where they started. It's a sad situation, but sometimes we see people in those declines. And, you know, especially when they have other underlying diseases, they have, you know, cancers and diabetes, or they're on dialysis, or, you know, other stuff is going on with them. They have, you know, maybe come in with a stroke and get a pneumonia with the stroke, and it's hard to fight all that at once. So with all of this stuff, you know, you have to protect yourself. Nobody's gonna protect you for you. You know, when we so if you have bad health, you know, I don't think I'd come in here and visit the neighbor guy who's in here with pneumonia. You know, visit the neighbor guy when he gets home. You know, call him on the phone, say, hey, I'm thinking about you, you know, send him a card, whatever. But you need to distance yourself from people with these infections to protect yourself. You know, and besides, if he's here sick, he probably just wants to roll over and go to sleep anyway. With the and all, like I said, all of it's with hand washing, and just kind of trying to, you know, take care of your Kleenex instead of leaving them lay all over the end table and germ everything up. You know, washing our dishes and that, you know, kind of stuff. And you'd be surprised how many people I have to remind to cover their mouth when they sneeze, or, you know, turn away, because you know, they just don't think about it. They'll be talking to me, you know, in the room, and after I've given them a treatment or before, and all of a sudden they just cover me, and I'm going, oh, I'm just thinking, you know, I just had 600,000 germs fly on me all at once. That's one of the reasons we all wear scrubs, because we leave all our germs here then. A cough does carry germs when somebody coughs, and it's like 21 feet. It's they did a big study, you know, and the whole room will just be these little germs, you know, that we can't see, you know, just are like super balls all over the room. And different viruses and bacteria have different lives outside our body. Like some stuff, like TB. TB is a fungus. TB is carried in our spit, or what we cough out, you know, and it's pretty well under control, but believe it or not, we see a couple cases of TB in this hospital every year. And, you know, if somebody, you know, coughs into a Kleenex and it lays it on the table, and, you know, the kitchen people come in with lunch and sit it down and kind of pick up that Kleenex and move it out of the way, that TB lives for like 24 hours outside the body, you know, on surfaces. But then other viruses are usually pretty fragile. They might die within an hour. So there's every different kind of bacteria or germ has a different lifetime outside the body. So those Clorox bleach kills everything, 99.9% of everything. So our mothers and grandmothers weren't too far off when they bleached everything, because it really did. And that's what we use here in the hospital in our little spray bottles. They call it something else, but it's really just bleach. You know, and when they're wiping off tables and you know, chairs and the doorknobs and stuff like that. The other thing that we wanted to bring up was flu shots and pneumonia shots. Very, very important. You only need one pneumonia shot in your lifetime, they say. There are some doctors out there now recommending pneumonia boosters if it's been 10 years, depending on, I think, the doctor and what's going on with your own personal health. But the recommendation is anybody who's over 65 should have a pneumonia and a flu shot. Of course, the flu shot's every fall. If you're under 65, if you have any underlying health problems, they recommend that you get the pneumonia shot and the flu shot. I have a young son who has had a pneumonia shot and a flu shot because he was born with heart disease, and he had his pneumonia shot before he was a year old. You know, even if I wasn't a healthcare provider, his cardiologist recommends very strongly that anybody who even lives in the same house with him have a flu shot every year, because if my other kids would get the flu at school and bring it home, you know, to him, and then he would catch it, he usually ends up in the hospital when he gets the flu. And so the other people in your family, if you have other people that live in your house, you know, they can bring it home to you that way too. And then on my next page, so yeah, ask your doctors about your flu shots and your pneumonia shots. If you're not, the flu shots, they start giving out again in about the middle of October. The pneumonia shot you can get anytime. It doesn't matter the season. Okay, on the back it just went through about cleaning your humidifiers and dehumidifiers that we all talked about. This next page, if you go on the back of this next page, there's like a little chart for you. about, it's telling you the symptoms of cold and bronchitis and flu and pneumonia. The symptoms and what you can do for those symptoms and when you need to call your doctor. Because some people get kind of confused about when to call the doctor. Like I said, for colds, which are viruses, and flus, which are viruses, there's not much you can do unless you get dehydrated or sick enough to be in the hospital, but let the darn stuff run its course. The bronchitises and the pneumonias, if they are bacterial or funguses, then we can treat you with antibiotics or antifungal things and steroids and stuff. But I find this as a handy little chart when I have patients in the hospital, just because they're still, you know, you're not 100% well when you go home from the hospital anymore. You know how Medicare is. And you know, so I like to educate the patients on if this happens, you know, if you get more short of breath, if you start coughing up yellow, green, or brown stuff, if you can't lie down and breathe comfortably, you need to come to the emergency room or you need to call your doctor, you know, that type of stuff. Because, you know, there are people who become well enough to go home, and then they get home and then they become very ill again. They might get a second infection, or the infection that they already had for some reason decided to take off and get worse again. It talks to you about fevers. Any fever over 101, you know, you should call your doctor if you're coughing and coughing up stuff, because that's a pretty good sign of a pneumonia or a bronchitis. Colds, you usually don't have a fever with just a regular everyday cold. And of course the flu, the scary thing about the flu is those darn flus go into pneumonia, and we have H influenza pneumonias. And those people become very ill. Those are the type of pneumonias that at the nursing homes, all of a sudden everybody at the nursing homes got a cold and sick and with pneumonia. It's usually like an H influenza pneumonia because it starts from the flu, and they're just a weakened condition anyway, and they can't fight it off. So it really gets them. And back in the, 1800s, you know, people, they'd have those big influenza epidemics when lots and lots of people died. And what was happening is those flus were going into pneumonias. And, you know, there was nobody had money, there wasn't hospitals, you know, you didn't have IV hydration, you didn't have oxygen to treat those people. So they'd go from these flus into these huge pneumonias, you know, and unfortunately pass away from them. So that's kind of why that flu is kind of you got to watch that flu. Okay. And that's all I had, unless you guys had individual questions. Since we're kind of putting different support groups together, all this stuff kind of hits people differently. Okay.